interview. My name is Susie England and I'm the Service Inner Manager at the Royal College of Occupational Therapy, and I'll be interviewing Claire and Jaime.
Hi everybody, my name's Claire Collett. I'm an occupational therapist and I work for Dorset Council's Technology Enabled Care team. We're a small specialist team of OTs and our time is dedicated to developing technology across the Adults and Housing Directorate.
Hi, I'm Jaime Guercio. I'm the Digital and Change Business Partner for Adult Social Care. So I sit in our corporate team and I support adult social care 100% of my time, looking at things from across technology enabled care through to other technologies that support our social work teams as well.
Thank you both for sparing the time today to build on your leadership journeys. So just as a bit of background for the listeners, so this interview is building on a piece of Health Education England funded work that sought to define the future proficiencies of allied health professionals. So our focus in the leadership journeys that you've been contributing to is to draw out how occupational therapists are working with others to use their digital and data skills to innovate their services. So we've got 9 questions that we're going to be going through. And so the first question is for Jaime, and this is about the project area. So what prompted you to get involved in this area?
So I think probably my own personal experiences with my family as well. I've got a huge passion in technology and digital generally, and I really do believe that it can help us with some of the social care challenges that we face today, and I think it can help people gain a level of independence as well. So, you know, my mum, and this is a very simple piece of technology, but it's always got to start with something simple, I think. When we got my mum an iPad, looking at the absolute change in that ability to have that social contact using that iPad and to be able to play some simple games and things like that. And also there's a friend of mine's, they bought their parent an Alexa, and again, to start with, they weren't particularly keen with this Alexa, but it became their best friend. And they were like saying, "Oh, Alexa told me a joke today," and it was so funny. And just seeing how people start to sort of really sort of get to grips with the technology, and I really do think it can make a difference. So yeah, it's just I've got a real sort of passion for it, really.
Yeah, I think you're spot on there with the simplicity of it. I think sometimes when you look at the sort of digital agenda, in terms of trying to apply it to practice, it can seem quite complicated, can't it? But it's amazing how many, especially I think with technology, like the two that you just described there, sort of tinkering around, playing. This is brilliant. Okay then, so that's what prompted you to get involved in this area. Why is it important? So, why do you think it's important for the profession? So obviously, in terms of occupational therapy, but the wider health and social care system as well. So in your case, working in a local authority, but also society. So why is it important that we improve in this area?
I mean, I've already said, I think technology-enabled care can help us solve some of the challenges that we face today with social care, and we just need to prove it. That's the hard bit. I think tech can extend the services that we've got on offer for people. It can give people that greater independence and control over their care and help support their well-being. And I think it can free up time for our care workers as well. So at the moment, there's a lot of time spent on admin tasks, and actually they want to be doing more face-to-face actual care work. And I do believe that tech can really help us to achieve some of those things. And it can help care providers as well to operate more efficiently, and they can do more to look after those that they support and their employees as well. And if we get this right and evidence the benefits, then more people will be able to take advantage of the benefits, including the service users and their families, who can feel more in control of their care. So it really can help the whole kind of ecosystem of social care, I think, and across our whole kind of integrated care system. We just need to be able to prove it, I guess.
Yeah, definitely. I'm going to put Claire on the spot a bit here, so you might hate me for this. But I just thought that, that Jaime really just brought up such a key point there around evidencing. And that can be quite tricky, can't it, as I think occupational therapists, that whole evidencing. I just wondered if you had any extra sort of thoughts to add on that about you know, I don't know, why do we sort of struggle with evidencing? Is there anything that you kind of learned through this project that makes it a bit more simpler?
I think, again, measuring outcomes, you know, is different. We have qualitative and quantitative, don't we, measures. And so we try to really, in a lot of our work, we try to really focus on qualitative for the people, for the people we're supporting, because, again, as what Jaime was saying, I think smart technology can really support people to achieve their full potential in life, and you know, it increases their independence, it helps them to remain well, and as an OT, it can help overcome barriers. You know, we know that there's lots of barriers that prevent people from doing the activities that matter to them. So when we're looking at evidencing, we're not just looking at perhaps wider sort of things like savings to the council, but it's about what is it that the individuals themselves are getting out of this. That's the most important person, the end user, really.
Brilliant. Yeah, so there's still real value in the narratives, isn't there, of real people and the difference it's made. Yeah, lovely. So I guess on to the next question, which is how do you talk about this topic area with others who may be less enthusiastic? So I guess what we're talking about is, I guess, as just reflecting on your experience of trying to get buy-in from people that have just needed a little bit more to get enthusiastic about technology.
Yeah, and I definitely come across this quite a bit, I think. But I personally just try to avoid talking too technical, and just to avoid that terminology altogether. But explaining the benefits of any technology that technology-enabled care can offer. But it's the case studies, I guess, really, that you really have to bring to life. So explaining those real life examples, and always try to hear from the service users themselves, so that they can talk about the actual benefits that they've received. And I found that people really need to hear that. There's no point in just sort of writing a report and going, oh, benefits are, you know, it can increase this or decrease that. It's got to be case study related, and it's got to come from those service users about their actual experiences. But then you also have to think about perhaps the audience that you're talking to. So we've obviously got our leadership as well, and they're not always necessarily 100% bought into some of the technology enabled care kind of concepts, and so they want facts and figures. They do want to see the benefits. They do want to see that it's going to make a difference to kind of budgets and things like that. So you have to understand who you're talking to in order to be able to kind of talk about that particular topic area. But generally, as long as you've got service users in there and their voice, then, and in very basic terms without too much technical speak, then that's got to be the way to go.
You're absolutely right. I think for me, when I looked at, I think all of the leadership journeys actually across this piece of work, that knowing your stakeholders, knowing that people need different information at different times is key to buy-in, isn't it, really?
Absolutely.
And how they want to receive that information, and you know, where narratives work and where other times, let's say it's the costings. But I guess it's also a very traditional face-to-face, you know, I guess working how occupational therapists work traditionally is very face-to-face, so you're going to need quite a bit of compelling evidence for both for changes, because people are nervous, aren't they, about change.
Absolutely. Yeah, and I think you've just got to make sure that you've got that opportunity for people to raise their questions, their concerns, and keep the communication, you know, open. And that's why, you know, the tech team at Dorset's so good, because that's that continual communication route there for people. So if they hear us talking about anything around some of the new technology, they can go straight in and ask any questions that they want, and have that continual engagement with it. So yeah, it's really good.
Brilliant. So we're going to move on from the project area to focus a little bit around an area that crops up a lot with projects, which is all around problem solving. And I guess that's because a lot of innovation is about breaking boundaries, doing new things. And so we all encounter problems, as well as obviously good things. So I'm going to ask Claire, what early setbacks later gave you an advantage in this project?
Well, in some of the early pilots that I ran, let's say over the last couple of years, I think not having much formal experience of project management raised the issue of this being a need to do from our point of view. You know, once once we then did that within the team, we undertook some training. Well, certainly I felt that we could look back and at what we did and learn valuable lessons on what not to do and how to do things differently going forward. And having the training has really enhanced how we look at new pilots now and how we plan them. So that was something that really was something we learned really from that, definitely.
Do you think that is about, it's interesting, because when I did my project management training, I really felt like there was so much synergy with the occupational therapy process, defining the problem, planning what you're going to do, thinking from the outset what your outcomes are. Do you think it is about a terminology with different stakeholders that project management training supports you with, or is it new skills in terms of piloting? I don't know if that came out as very articulate what I just said.
No, I think, project management, you can look at it as a kind of a generic sort of practice, but actually with the course that we did was aligned with our NHS in Dorset and how their frontline teams and staff look at project management. So it was really great for us in the local authority, us as to join colleagues in the NHS in Dorset and look at how it's applied there. But again, applying it across from an OT point of view, we've had to sort of look at some of the core principles of project management, and the course at times was very easy to undertake because it was kind of, like you say, followed the OT process a lot of the time. You have to review and as well the part, a pilot, you have to and that's part of project management, writing up an evaluation. So yeah, it really did sort of sink in and sort of associate itself, I think, with what we do in occupational therapy.
Brilliant. So the next question I'm going to ask you is really about your experience and, how did you use your experience to influence decision making in this project?
Well, I think in terms of future pilots, I think we used experiences from previous pilots, things that went well, things that didn't go so well. And if understanding the concept of how a pilot's going to contribute to the social care directorate is really important, and aligning them to the objectives are really key going forward. We don't want to carry out pilots of technology just because a company says their product is the best. It's got to link in with the wider issues that social care is experiencing and how we can help those who benefit the most, obviously the residents of Dorset. I don't know if Jaime, you sort of you were nodding there. You sort of agree with that, really, isn't it?
It's definitely.
It's how we kind of look at, often we'll see brilliant products, but we often think, is that going to whose need is that meeting? What are we sort of making sure that aligns with what we're facing? Could be issues and crises in social care, really.
Yeah, and to add to that, if I may as well, is I think again, sort of learning, some of the pilots that we've done in the past have been quite I don't know, maybe we haven't shouted about them enough. And so we've got the opportunity now. We've got in place a sort of governance structure with the digital development group and things. So it allows us now to go through and bring highlight reports in about those pilots and the things that we're doing. Again, exactly as Claire said, to kind of raise the profile, but for the rest of the directorate to link it to their work and for them to understand how it sits and fits. So that digital development group now, we've got, it was quite full of tech at the last one, wasn't it? We had quite a few papers to bring about updates from pilots or new pilots that we might be kicking off and things. And so lots of engagement and lots of questions from senior managers within the directorate and getting people quite close to that work. So I think that's been a real sort of key learning as well, is shouting more about the work that we're doing and making it more kind of out there.
I think really, really important things that we're saying is linking it, isn't it, to strategic I say strategic plans, but linking it strategically where you're going, but also the whole lessons learned as well, really thinking about what are we learning and how is it applying to other aspects of either your team or other teams' work. Brilliant. So this is, I think that was a good question. Would you make the same decisions again?
Possibly not.
Good. You've learned something then.
That's it. For one example, one pilot, we allowed the tech company to lead the direction of travel in terms of timescales, and they were keen to get going, but we still had a lot of the tasks that we needed to get in place, or first. And what that then led to poor communications and lower uptake. And so it goes back to that project management, that core project management process. I think so. Having done the course, and that has helped us a lot to sort of think, that's where we went wrong there. We're not going to do that again. So.
I love that, because it also talks about the value of you knowing your context, and that is so important, isn't it, of projects, that when the right time is. And in some ways, that whole timescale things can't always be, it's got to be an agreement, isn't it? Because you better know your team and the context in which you're providing that tech.
Yes, definitely.
Yeah. Okay, so I'm on to the last problem solving question. This one's heading towards Jaime. How do you resolve conflict within a project team?
Well, we never have any conflicts.
I don't believe it.
Well, I think as a project team, the good thing about providing that project structure is that you've written down what it is that you're actually trying to achieve, and that you are all aiming towards that same goal. So that helps massively if you've got that kind of project structure and governance that's supporting you in the piece of work anyway, and it helps you to stay on track. So if there are any disagreements, it's going back to the basics. What is it that we're trying to achieve? And quite often now, thanks to digital tools, we use things like whiteboards, voting, and sort of collaboration to kind of bring those things out, and it works really quite well by doing quick sort of voting tools, or quick whiteboards and post-it notes, and getting everything out and getting everybody to talk. So those things are really quite helpful. But also, to my point to the last question, we have got a governance group if we need it, and if you've got that right project structure and you've been clear about what it is you're trying to achieve and what's in scope and out of scope and things like that, you can always go up to that governance group with a clear kind of paper, document, what have you, and say, here are our options, here's decisions, and the wider group can support you in making a decision if you can't kind of come to some agreement within the team itself. But good communication, open, keeping again, being able to stay in touch quite a lot, and just being able to sort of informally check in and ask questions and things across the whole team, I think is really, really important. So
brilliant. Yeah, lovely. I don't think I've got anything to add. So we're going to move on from problem solving, you'll be pleased to know, and obviously both of you are leaders, so we're just going to sort of finish up with a couple of questions about you as leaders, really. So the first one, and I don't mind who goes for it first. What challenges do leaders face, and do you have any suggestions for others developing their leadership skills?
Claire, go for it.
Okay, well, I think in terms of OT leadership, having the motivation to inspire others can be a challenge at times, and finding the time to do that. But I always find if you get people to focus on the value that their work provides, this is one way to help them share their own visions, and this helps prove their work makes a difference. And developing others and encouraging growth can be hard if the opportunities aren't there. So sometimes they are. You just have to look a bit harder and not be afraid to ask and inquire. You take a risk and go for it. I've recently done that with my own sort of learning, and it paid off. But I think creating a space for ideas within a team where everyone can share helps and encourages productive discussions, and I think this enables us all or individuals in a team or really grow. So I think that's from and also this is something I personally sometimes suffer from, is the imposter syndrome. I often say to myself, should I be doing this or taking this initiative? And it's hard to think you're capable of a particular role, but if you get feedback from managers and your peers, that can help, and the ability to develop your own skills in difficult areas is something I personally try and achieve. But you know, I attend courses, training, meetings and webinars where I can. So that's my advice, really.
It crops up a lot, Claire, and especially with this piece of work, the imposter syndrome, and just not feeling, yeah, what, me, my project, or you know what I've been doing.
Yes.
And I guess it's because sometimes you just think you've got to know it all. But I think just listening to you both already in this interview, there's a lot of shared decision making, working together and learning together, and recognizing no one person's got the answer. You know, it is about, you know, being on the same page and working together to find a solution, isn't it?
Yeah, definitely.
What about you, Jaime?
So I guess I'm coming from it from a kind of digital leadership perspective more so, and so I've undertaking a course called Leading in 4D, and that is all about kind of become this sort of digital leader, and that's been really, really eye-opening, I suppose. And so just a few thoughts from that is that it is quite tough. You know, digital leaders need to be creative, innovative, need to have strong networking, they need to collaborate, they need to persuade, mobilize the workforce. I mean, it goes on, and it's like, you know, they have to think about so much stuff. So I'd highly recommend anyone looking into kind of digital leadership, taking on digital fellowships or any other kind of leadership courses like that, because it really does sort of, you have to put effort in, I think, to take that workforce with you and to be able to kind of sell that journey and that vision, and for people to kind of jump on board, but also, you know, for the workforce to ensure that they're going to be resilient as well to kind of the changes and things that you're kind of putting in place. So yeah, if there's any opportunities for those kind of digital fellowships or leadership courses, then yeah, have a go.
Thanks for sharing that one. I shall be looking that one up myself. So on to the last question, which is, I think it's an interesting one. I'm interested to hear both of your answers for this, really. How do you see this topic area evolving over the next 5 years? So what can we expect, do you think?
I would say it's not going away. It's going to get faster, bigger, louder. I think really we are just on the start of our journey. I think we're almost just a toe in the water here, and we're just getting the kind of workforce just sort of almost testing how digitally ready we are for some of these technologies to come. And I think you know, it's going to move quite fast. Having a pandemic has probably helped with that. But it's not going to be that far away, I think, before people will be expecting it. And actually, I've got some family in the States, and they are already, you know, receiving some fairly hefty technology to support them with some ailments that they've got, quite low level ailments, and it's just expected over there that that's kind of what's happening. And I think that that's not that far away, so it's going to get bigger and faster, and I think we need to be really ready for it. So I don't know what you think, Claire.
No, I agree. It is that it's certainly becoming, it has been the topic of the moment for a while, but it's certainly going to become that in the future. And I'm actually later this week, Susie, I'm doing a lecture at one of our local universities on digital technology and OT practice. And, you know, that's going to be quite, it's obviously supporting the third year students who are just about to go out into practice, and it's looking at all things digital, really. Obviously the RCOT guidelines, you know, we're looking at how technology is supporting communities, how are people digitally excluded, and how that relates to occupational justice, and it's just sort of developing and also letting students know about the training opportunities for, you know, digital literacy skills. So really, yes, it's going to become something that's in generations we'll all be, you know, used to sort of the digital way, but at the moment we've still got quite a challenge to you know, get that out there and to make it not feel so frightening and scary to a lot of people.
Yeah, I'm so pleased you're doing that, actually, that lecture, because it brings it home, doesn't it? It brings some reality to it as well, because you know, I think coming from a higher education background myself, I think learners are kind of used to using digital tools in the learning environment, you know, a whole range of, you know, remote classrooms. So to be actually to start seeing that out in practice is so important. And you raised some really good points as well around accessibility and justice. So yeah, that sounds exciting.
Yes, yeah, I'm busy planning it ready for Friday.
Yeah. Well, good luck.
Thank you.
It's been really wonderful just hearing a little bit more about the project, but also about both of you as well, and how you've worked together to really make a difference in the area that you work. So I guess it's just up to me now just to thank you both for your time, and for those of you that are listening to this this Q&A session, check out their leadership journey and consider signing up to the live Q&A session in January to hear more. Thank you.
Thank you.